Benedict, is it okay if I let people in now?
Sorry, I was on another tab. Yeah, it's fine.
Yeah, all right, thanks.
Welcome to our Caribbean and African Targeted Health Improvement Program, CAHN Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CAHN is funded by the National Lottery Community Fund.
Hello and good morning, everyone. I hope you're all having a wonderful start to the weekend. My name is Tayo Ayeni. I'm a hospital and community-based pharmacist, and I'll be your host for today's session. Welcome to another CAN's Health Hour. I'm just trying to make sure if you can hear me, if you can just pop a yes in the comments. If at any point you're having any technical issues, just make sure to use the comment to make sure that the that me and the host can help you out as well. Thank you for joining us. Like I said earlier, if you're new here, we're delighted to have you. So this webinar is dedicated to discussing key health topics affecting the Black community, and it features experts presentations from healthcare professionals across the globe, highlighted in the video that you just watched before. So today's session will be focusing on the benefits of health checks and screening, presented by our lovely Dr. Omotola Omotoso. This is an incredibly important topic because regular health checks and screenings are essential in identifying potential health concerns early. You learn about a variety of screenings in the presentation, some you may be already familiar with, and others that might be new to you. I encourage everyone to please stay engaged throughout the throughout the session. Feel free to drop your questions in the chat section, which will be monitored during the presentation. We'll also have an interactive Q&A session at the end. So if you have any questions, you're free to unmute yourself, raise your hand up, and then I'll let the doctor answer questions in order. We'll also love to know where you're tuning in from. So if you can please share your location in the chat and if you're watching alone or if you're watching with family members. So now just quickly before we begin, let me introduce Dr. Omotola Omotoso. So he's a MBCHB DPD and he's a dedicated and compassionate general practitioner based at the Village Surgery in Altrincham, Manchester. He has extensive experience in primary care and he also serves as a GP trainer, nurturing the next generation of medical professionals. In addition to his work in general practice, he's also a remote GP with a leading digital health service. So he's combining technology with personalized care to enhance patient outcomes. He trained in lifestyle medicines and he is a firm believer in principle that prevention is better than cure. His holistic approach emphasizes empowering patients to make informed choices about their health focusing on disease presentation and overall well-being. His commitment to patient-centered care and innovation makes him a trusted and forward-thinking figure in the field of modern medicine. Without further ado, Dr. Omotola, the floor is yours.
Okay, thank you very much, Taya, for that introduction. I was still wondering, wow, is that me really? Yeah, indeed. Thank you very much. And thank you for having me at CAHN. Really appreciate that. And I will say thank you also for everyone for joining in. I can appreciate how important Saturdays are to us and creating a time to join on this occasion is quite laudable and I really appreciate it. Again, thank you for the opportunity, Khan. Okay, so I will try share my screen at this point and we'll move on. Okay.
Sorry, Dr. Omotola, you're on mute.
Hello.
Yeah, we can hear you now. Thank you, Dr.
Brilliant. Oh, my sincere apologies. I didn't realize that. Can you see my screen at the moment?
We could before, but not anymore. Yeah, okay, yeah, we can see it now. If
Can
you
you
could
see now?
please
All
just
right.
put it on the slideshow and then
Slideshow.
yeah,
Okay.
thank you. Yeah, that's
Oh.
great. Thank you.
All right, so we'll be running through some slides. So, topic of today, benefit of health checks and screening, and with that rider, be in health. A little bit about myself. That's my humble self. I'm a Christian, and purpose of mentioning that is it does underpin, the principles and approach to life. I'm a son, a brother, a husband, father, uncle, cousin, a friend, and a colleague and I'm a GP and also a GP trainer. Why am I mentioning this? It just gives me, and which I appreciate will apply to every one of us also, that sense of appreciation of what we have. Talking about mental well-being, one of the evidence-proven principles is appreciating the now. It's found to be helpful mentally. Okay, so I appreciate all this, having friends, having relatives. And the other thing it puts that onus of responsibility. So thinking about whenever you're talking or thinking about yourself, know that many things, many people are connected to you. And talking about faith-based is also emphasizes that being a person of faith does not negate your responsibility when it comes to your health. Okay, so we'll be going through this outline of today, talking about the checks, eligibility, what happens when you go for the NHS checks, the results, and the breakdown, and everything else as listed on that outline. Okay. Now, for the purpose of this presentation, we're focusing on the NHS based on the location of where we are. Different things operate in different countries, and they do have some form of uniformity with what also cuts across in other countries, including that of the NHS. And on the last point there, we will be having some take-home points, which you can actually practicalize. So some quick questions, just have this at the back of your mind, or you could actually pop it onto the chat page. Say, when should we start attending for health check? Next, how often should we attend for health check? When should we start attending for screening? And for the ladies, when should a pregnant lady book with the midwife? And if you're over 40, just for everyone that could be on the screen, over 40, have you been invited by your GP surgery for health check? Okay, these are some of the questions we'll be going through along the way. By the end of this presentation, I believe we should be able to answer this. Okay. So talking about the NHS Health Check is a free platform for assessing our overall health. Okay. And during such a session, the risk of getting particular diseases are discussed and how one can mitigate against that, or at least reduce the risk of developing such diseases are discussed with a healthcare professional that attends to you. And usually for anyone that's over 65, discussion is also directed towards dementia and the symptoms that the individual is supposed to look out for. And what's the eligibility? We have to be between the age of 40 to 74. During those times, you're expected to be invited for regular health check. Next one is the person should have no pre-existing health conditions. And by that, I meant if anything had been diagnosed before the age of 40, you will be on a sort of an automated review, in which case you will be regularly reviewed by the GP surgery, either with the nurse or the GP or the pharmacist. And at times, if it's something that requires an hospital specialist intervention also, there will be a scheduled follow-up with regards to that. And the next eligibility is you should be registered with your GP. Now, with no pre-existing health condition, registration with the GP, age 40 to 74, you should be invited every 5 years to have this health check. I will go through what is expected during that time. So you will be seen by a healthcare professional, usually takes about 20 to 30 minutes, thereabout. And the things that are done there are the measurement of the weight and height, the waist, blood pressure. Okay. Then blood tests are done to check the cholesterol and the glucose level at that moment. The professional will also ask about family history, all because those are significant because it can help in identifying the risk of developing some things if such runs in the family. Smoking and how much of the cigarette or whatever the agent is also assessed. The alcohol intake and how much of alcohol is being consumed, that will also be discussed. Physical activity is also assessed, all because all of these help towards achieving a well-being, a healthy well-being of an individual. The age, the gender, and the ethnicity are also assessed and recorded. And that's because different things have the risk associated with the age, gender, and the ethnicity of individual. So it's not to be taken as an offense if all those have been checked while you attend for the health check. Now, during the health check session, within that 20, 30 minutes, the outcome of those examinations and discussions will be discussed. CV risk, that is the cardiovascular risk, has to do with the risk of having any problem with the heart and blood vessels, okay, over the next 10 years. And by that, I mean things like heart attack, stroke, um, other problem with the blood vessels in the individual. The risk is assessed during that session so that such risk can be reduced in the individual. So if the person is at a high risk of developing heart attack or stroke, which is being predicted by the outcome of the blood results, the weight and height, then factors are put in place to mitigate against that so that it will lower the risk for the individual. Now, talking about those factors or the risk, we have the modifiable and non-modifiable ones. So non-modifiable ones like the age, ethnicity, the family history, we can't do anything about that. So we just go ahead enjoying it as it is. Now, the modifiable ones like smoking, cholesterol, blood pressure, physical activities, we have control over that. And the onus is on us to engage as recommended. Now, the result of the BMI, which is the body mass index, that is the weight in relation to the height of an individual. That will be discussed during such session. And the outcome of the blood pressure, cholesterol, those also will be discussed. Now, the risk of developing diabetes mellitus is also assessed at that time following the blood sugar testing, and everything that is needful in ensuring that the risk is reduced is recommended. So the result is discussed, actions to help improve that score such that this score will not be high in 10 years' time. Those will also be discussed. And if need be, that the individual will need some form of support to achieve this, they are signposted to services that can help with that. Other health check that will benefit us are the dental check. The dentist recommend a 6 monthly check for every individual at a starting point. But once the person is seen in the first clinic, recommendation will be made if it's going to be 6 monthly, 1 yearly, or thereabout in the individual, depending on the examination finding. But in the absence of any dental problem, it's often 6 to 2 years. Okay, so ensuring we register with the dentist and ensuring that we're seen at least every 6 to 2 years is plausible. Okay. The next one is the eye check. The NHS recommends that we check our eye every 2 yearly. Okay, that's in the absence of any underlying problem. If there is an underlying problem, it could be shorter or either way, depending on the recommendation of the specialist. Now, talking about the NHS screening, now that's separate from the health check. Now, the NHS screening test is mainly for healthy people, and it's to check who might be at a high risk of developing a particular health condition. Okay, and the purpose of this is to offer the screening to those people that will benefit from it the most. So those that are at a higher risk of developing a particular health condition in the future, they are the ones invited to have the screening test as related to whatever puts them at the risk. And these are often offered early so that the individual, if screened and identified to be at a risk, an early treatment can be offered. Otherwise, an information can be given to them to make an informed decision. Maybe they want to proceed with the treatment or not. Now, following the screening, depending on the screening test that was being done, the outcome could either be normal, in which case is negative, and what that means is just that the individual has a low risk of having that health problem that is being screened for at that moment. Okay, it doesn't mean the person might not have a higher risk or even have the problem in the future, but it just tells us that it's a low risk at that moment. Okay, and if the result comes out as being high, in which case it is positive, it means the person is at a high risk or the person is having that condition, and on such occasion, they will be offered a test, what we call the diagnostic test, to confirm if the condition is really present or not. And following that, treatment can be offered and further advice can be discussed. Okay. Now, there's a benefit to this because finding out about the problem in an early stage means there's a higher success of treatment outcome, which will make it more effective. Okay. Now, we must bear in mind that screening on its own is not perfect. We will talk about some of those later, the demerits of the screening. Okay. So bearing in mind that it's not always perfect and it can lead to some difficult decision when the screening test is done. Now, talking about the different types of screenings that's been offered by the NHS in England. Now, we do have like an independent body that is called the UK National Screening Committee. They are the ones that advise the National Health Scheme on which screening program should be offered. And they do this based on, evidences, statistics about what is required at a particular time for individuals, in which case they measure the benefit versus the harm before deciding the recommendation to the NHS. Okay, and they recommend the screening that they believe to have a higher benefit in the individual. Now, that is not being just set in stone. Okay, they always review the recommendations every 3 years to know maybe there's a need to include something else or if something else needs to be removed. Now, this UK National Screening Committee advised the different countries in the United Kingdom and Northern Ireland. So with some slight modification depending on the country where you are, either England, Scotland, Wales, and Northern Ireland. But apart from that, there is a basic uniformity amongst all. So we start with where life begins, screening in pregnancy. Now, during pregnancy, individuals are screened for infectious disease, and by that I mean the pregnant lady. So those include hepatitis B, HIV, and as listed there. Okay, they're also screened for chromosome disease, which are the ones listed there. The pregnant lady is also screened for sickle cell and thalassemia, and there are screening scans done. There is a booking scan earlier during pregnancy, and there is a screening scan, which is also done at 20 weeks. For anyone that's had background diabetes, they have the regular high screening during pregnancy. And this is just a picture diagram of the chronological tests that are offered during pregnancy. So right from beginning, okay, we can see what are recommended, the blood tests that are done, the scans that are done, the blood tests that are done again along the way, up to the time of pregnancy. I'm sorry, delivery, my apologies. The delivery and also the screening tests that are done for the baby. So next one will be the screening of a new babies. So they have physical examination, which we call the neonatal and infant physical examination. So the neonatal one is done between the age of 1 to 3 days. So if the delivery was in the hospital, that's often done before the discharge. If it is a home delivery, the GP or a midwife will come and do that at home within that time. So if we know of anyone or if anyone has had a delivery and did not have the baby checked, you should discuss that with your healthcare professional, either with the GP or with the midwife. And the findings are recorded in the Red Book as well as the medical record of the baby. Another test is done at 6 to 8 weeks, during which you are invited to your GP surgery to have this done. This is usually done at the GP surgery. The hearing screening is another test that is a screening test for babies. It's done between the first day to 5 weeks post-delivery. There's what we call the blood spot. This is often done by day 5 and is done if the child has been discharged. It's done at home by the midwife. If the baby is still in the hospital, it will be done by the midwife in the hospital. It's mainly to check for some specific problems, things that we call cystic fibrosis, which has to do with some glands in the lungs, in the bowels. They also screen the baby for sickle cell disease on such occasion. They check for what we call hypothyroidism, congenital hypothyroidism that has to do with the functioning of an important gland in the body in the baby on such occasion. Then there is the school entry screening. This is usually done in the school. So we might get letters from the children's school to say, oh, they're going to have the eye testing or hearing test in the school. So the professional goes to the school and undertakes that. Now, with that of the screening test, there's been some form of a bit of a caveat to that at the moment. They still do the eye screening test for children in school, but for the hearing test, the conclusion with that of the National Screening Committee is where this has been established to continue at the moment, but in other places, the research is still going on regarding the benefit of the hearing test during this session in school. Diabetic screening, this is done for anyone with diabetes from age 12. And by the diabetic screening, I mean just the high testing because diabetes affects the vision. So people that have diabetes from age of 12, they're invited to have the diabetic eye screening test. Cervical screening is for the ladies. You get an invite from age 25 to 64, And this is done every 3 years until age 49, usually at the GP surgery. From age 50 to 64, it is done every 5 years. Thereafter, the risk is said to be lower of developing the bugs that are being checked in the cervix, which can ultimately increase the risk of cervical cancer. So anyone after 64, you can make a personal request for that. Breast screening, as a lady, you will be invited for the mammogram between the age of 50 to 70. After age 70, it will have to be a self-referral. That's what we call abdominal aortic aneurysm. This is strictly just for the men at the age of 65. You will get an invite from the National Screening Committee to attend for this. And in this case, it's a form of a scan done on the abdomen. It's to check if the person that is at a risk of developing what we call aneurysm, which is like a ballooning of the major blood vessel in the body. So this is just a schematic diagram of that major blood vessel coming from the heart on this curve. It looks like a question mark. Okay. Then it goes down at the back. This portion that is bubbled out is what we call the aneurysm. So this is done for men at age 65, and if it is a low risk or there is no risk at all, that is the only one that is done. If there is a higher risk, then the person can be invited or signposted for treatment. Now, in Northern Ireland, there's what we call the Family Health Check. And this involves all those other things we've mentioned, specifically targeted at the farmers and their family, all because of health risk that they're exposed to there. Now, just for another few seconds, we'll quickly run through these videos. So please, if you give me a moment for this, please. It just tells us about the screening test that's expected in an individual. So here we go.
I'm so sorry, Doctor. The sound is not coming through as well as it did earlier.
Oh, okay.
Would you be able to copy the links into the chat and I can try and see if I
Yes.
from my side?
All right. Let me see. Oh, okay.
Thank you. I'll see if I can share.
All right. You're welcome.
Okay, it's just going to an advert, so I'll get the advert.
All right. Oh, apologies about that. It worked earlier when we tried it.
I know this is the thing with technology.
All right. So that's the joy of technology at times.
Exactly. Yeah, let me see if I can share it.
All right. Should I stop sharing on my side?
Yes, please, if you don't
Okay.
mind. Let me see. Okay, I'll just get the other one open as well, so we don't have to go back to it.
Okay.
This is
Okay. Right. Thank you for your patience, everyone. We know technology isn't always reliable, is it? Okay.
Oh,
Everyone
you.
Yeah, I can see it.
Okay.
Yes.
This will work. Let's see how we get on.
This is Ahmed. During his life, he'll be offered several screening tests. These could find health conditions before he gets symptoms. Screening is always a choice. Ahmed can decide which tests, if any, are right for him. When he's 12, Ahmed is offered diabetic eye screening because he has diabetes. This checks for early signs of diabetic retinopathy, a condition that can cause blindness if not treated. Ahmed will be invited for eye screening at least once every 2 years. Regular eye tests with his optician are different to screening, so Ahmed should still have those as well. When he's 60, Ahmed is offered bowel cancer screening. He's sent a home test kit known as a FIT kit. A sample of his poo is checked for blood, which could be an early sign of bowel cancer. He'll get this kit every 2 years until his 75th birthday. From 75, Ahmed can call the screening program for a kit every 2 years if he wants to. Around the time Ahmed turns 65, he's offered abdominal aortic aneurysm screening. This is a scan to look for a swelling in the main blood vessel that goes down from the heart. This swelling is called an aneurysm. If Ahmed has a swelling that bursts, he may die. But if found early, most aneurysms can be treated. Remember that screening is always a choice. You can decide which tests, if any, are right for you. For more information or support, speak to a doctor or visit nhs.uk/screening.
Okay, that's the first video. Dr. Omotola, would you like me to play the next one now? Should I play it now?
Yes, please.
Okay, will do. Thanks. Well, that's if YouTube will actually listen. I've been pressing a button and it's not working. Let me see if I can try something else. Just won't escape this week. There we go. Right. Okay, next one. Right, I'll just have to start sharing again because it's being a bit strange. Thank you
All right. Yeah.
for patience, everybody. Try again.
Yeah. So the second one just shows almost a similar sequence of what is expected of a lady in terms of the screening journey as they progress in life. So we have
Okay,
some common things, but there are some specific ones for the lady. Thank you, Ruth.
no problem. Thank you.
Mia. During her life, she'll be offered several screening tests. These could find health conditions before she gets symptoms. Screening is always a choice. Mia can decide which tests, if any, are right for her. When she's 12, Mia is offered diabetic eye screening because she has diabetes. This checks for early signs of diabetic retinopathy, a condition that can cause blindness if it's not treated. Mia will be invited for eye screening at least once every 2 years. Regular eye tests with her optician are different to screening, so Mia should still have those as well. Mia will soon turn 25 and has just got her first invitation for cervical screening, sometimes called the smear test. Cervical screening does not test for cancer. It looks for the human papillomavirus, known as HPV, which many people can have without even knowing. If the virus is found, screening checks for changes to cells in the cervix. These changes may lead to cancer if left untreated. Mia will be regularly invited for cervical screening until she is 64. Between the ages of 50 and 53, Mia is offered breast screening. She will be invited for breast screening every 3 years until her 71st birthday. It uses a type of X-ray test called a mammogram. This can spot breast cancers when they're too small to see or feel. She can then ask her local breast screening unit for an appointment every 3 years if she still wants to be screened. When she's 60, Mia is offered bowel cancer screening. She's sent a home test kit known as a FIT kit. A sample of her poo is checked for blood, which could be an early sign of bowel cancer. She'll get this kit every 2 years until her 75th birthday. From 75, Mia can call the screening program for a kit every 2 years if she wants to. Remember that screening is always a choice. You can decide which tests, if any, are right for you. For more information or support, speak to a doctor or visit nhs.uk/screening.
Okay, hopefully everybody heard and saw that okay.
Yeah, that was perfect.
Great. Dr. Omotola, you are on mute again.
Okay. I think I should be unmuted now, is it?
Yes, we can hear you again. Thank you.
Brilliant. Okay, so we go back onto the screen. Thank you for your time, and thanks, Ruth, for sharing that. Okay. So, yeah, so that of the bowel has also been mentioned in the video. So we proceed to the benefits as highlighted in what you've learned so far. So we can see part of the benefits or some of the benefits are early detection of a disease. So identifying it early will help in determining what next step will be. Now, prevention of some serious health issues also come into play in this occasion because they are detected early. This also lowers the risk of life-threatening complications in an individual and increases the life expectancy, reducing the risk of preventable disease. And come to think of it, it helps to reduce or save the cost in the healthcare, either as an individual or for the system. And early treatment is more effective. You have a better outcome from the treatment when the condition is identified and treated early. It helps the individual to make better informed decisions about their health, reducing the chance of developing a condition or complication from an underlying health problems. And it gives the peace of mind, preventing avoidable death. Now, the risk and limitations is they are not always accurate. A false positive result can come back, in which case it is indeed showing that the person has tested high risk, whereas there isn't anything, and that can cause unnecessary anxiety in an individual. On the other side, a false negative one can occur, in which people start ignoring the symptom, thinking they've already had a screening test and it was negative. On occasions, it can bring about difficult decisions. For example, in pregnancy, if a screening is done and requires further screening, it puts the baby at risk. And even if the outcome comes out being high risk in an individual, then the decision to make or to take a step, whether to continue with the pregnancy or not, becomes an emotionally disturbing one on such occasion. Now, the anxiety of knowing that the individual could be at a high risk, maybe from family history or any other screening test, is also a sort of limitation. And the last point there says, even if the screening test is negative or normal, one could still develop the condition. Now, all these still do not negate the effect of, attending to screening tests. Now, in some services, they have the private companies offering screening tests, and this could be much more than what is recommended by the National Screening Committee. And this also occurs in some different countries or provinces. Take-home point at this junction will be, let's all engage with our GP. Ensure you register with the GP, even if there is no health problem. Attend when invited for health checks or screening. Contact your GP if you're not invited when expected. And let's bear in mind that screening is for healthy people. It's not a diagnostic test, so it doesn't confirm a particular health condition. It's a screening to prevent such health condition from occurring. Early detection increases a better chance of treatment outcome. And if symptoms arise still, call for medical attention. Don't feel, since you've already gone for the screening, we don't need to contact the doctor. Please still do. And when pregnant, ensure you register with the midwife. Going back to our questions asked in the beginning, I believe all these slides have been able to answer that. And talking about what time we're supposed to register with the midwife, as soon as you know you're pregnant, usually before 10 weeks, because that's when the needful tests will need to be done, including the booking scan. Okay. Now, let's challenge ourselves to this saying that we should take care of our body. It's the only place we have to live. That's a quote from Jim Rohn. For reference purposes, I have that, and thank you, everyone.
Thank you so much. Omotoso, for that wonderful presentation. I hope that each and every one of us took something away from it and also from the video as well. So we're just gonna off to the Q&A section quickly. We have about 15 minutes before we wrap up so that we can all get on with our weekend. So if you want to ask any questions, you can either put the hands up and I can unmute you and let you, or you can just put questions in the chat box as well, and Dr. Omotola will just go through them. So there's been thankfully
So sorry, Tayo. Could I just chip in to ask Dr. Omotola if you can please stop sharing your screen? Don't know if you realize it's still sharing. Yeah, great. Thank you so much.
Thank you, Ruth. Sorry, I didn't even realize. So yeah, so either put your questions in the chat box or raise your hands up and Dr. Omotola, and I'll unmute you and Dr. Omotola can answer them. So we got one from YouTube that I can just direct to you, Dr. Omotola. So it's the person wrote that they noticed that though 1 in 4 Black men get prostate cancer and 1 in 8 Caucasian men, there's still no standard screening test for men in the UK. How can the NHS local community groups help with this?
Oh, thank you. Excellent question. Yeah, that's still something that's being debated at the moment, and there are conflicts about that. Now, like mentioned earlier, the National Screening Committee, they're the ones that look into that to see what would be of benefit for people that could be at risk at one time or the other. Unfortunately, that of the prostate cancer has not been um, certified to be a recommended screening test. However, they do say anyone from 40 or 50 that requires to have a prostate examination done can request that with their GP. Now, two things are often done when it comes to prostate examination. So either, well, actually, one and two, yeah, two of them. Doing the examination in which you can go to your GP and request you want to have the prostate examined. So what the GP does is they examine it from the back passage. And by that I mean the anus, because that's the way that the prostate can be assessed. A bit of downside about that is you can only feel the posterior surface, that's the back of the prostate. You don't know what is going on in the middle and in the front. And the other thing that is done is the blood test, which is the prostate-specific antigen. Now, why that is still not yet been approved nationwide as a form of screening test is different things can contribute to the elevation of that result. Okay, things like water infection, trauma to the prostate, um, stones like urinary stones, they can cause that PSA to be elevated. Now, that can cause an unwanted anxiety in the individual and they can panic because elevated PSA is what is expected in prostate cancer also. However, if one has it done and is elevated, it just escalates the need to have further investigation. So there's still no harm in doing it, but I wouldn't say completely no harm because the anxiety can cause a harm itself. So, and you're right with the statistics, it's quite common, especially among the Black community. So what I will recommend is contact your GP to request that. And if there is family history of that also increases the risk. So I will say, the Black community, Afro-Caribbean, family history, 40 and above, contact your GP to request a testing for that. But bear in mind those limitations that it could come back being high, whereas there isn't anything, and it could come back being low, whereas there is something.
Thank you very much for that answer. I've just got a quick question. I noticed while you were speaking as well, you were saying that loads of private healthcare companies offer different various screening as well. Do you like move away from that because they have like loads of screening options, and then I know normally they either get sent back to the GP, and some GPs are a bit hesitant to kind of take that on because it's not tests that they themselves would take on. Do you kind of advise patients away from that, especially if like you don't like your practice or practices don't offer that as like those screening tests that the patients want to because of XYZ reason?
Yes, good question, Tayo. Thank you very much. Yes, and we often advise patients not to. Okay, although the final decision is left to the patient because they will have a reason for requesting it. Some bits of caveat to that is for anyone that has health anxiety, they will want to do everything. And part of what is discussed at times is you could, if you do the whole testing that's available at one time or the other, there's that chance that there might be something out of place, which doesn't necessarily mean there is a health problem. Okay. Of course, you never know which one could be, because when you do it at that time, part of what that will do is going to trigger the pathway of having to investigate further. And bearing in mind that the one that is universally acceptable or that is universally approved will be the one by the National Screening Committee. So they would have gone through all these phases, checking the limitations, the demerits, the anxiety, the unnecessary investigations this will cause before recommending specific ones. So what we advise is you notice any symptom that you're not sure, I'm sure about, or there is a family history that puts you at a risk of something, speak with your GP. If it's something offered under the NHS or recommended by the National Screening Committee, then action can be taken because looking at it, things like the bowel screening, which is at age 60, if the individual has a high family um, history or risk factors in such a case, they don't have to wait till 60. They might be put into the system much more earlier, especially if they have the symptoms. And that can be discussed with your GP as well as escalated to the hospital. So if, let's say, dad, mom had bowel cancer at a younger age, and the individual is now having symptoms, don't wait till the age of 60 to wait for the screening. Discuss with your GP, even at an earlier stage, who can now escalate and cascade things so that you wouldn't have to wait till that screening period before you're investigated. But private ones, all because of the potential anxiety and unnecessary investigations this can lead on to, is often not advisable.
Thank you so much for that. Thank you.
You're welcome.
We've just got some more. Thank you for everyone that's asking questions on the different platforms. So I don't know if this is a question or more like of a statement, but someone says, can Dr. Omotola reiterate and encourage men especially to attend their GP if they identify any health problems? Men tend to be reluctant to go to the doctors, and this is very true, especially like in the Black community. My dad was very reluctant to go, even with my mom having issues and him having stuff running in the family as well. So is there any words of advice that you can just offer them so that they can go get screened earlier?
Yes, you're correct. And thank you also for that comment, whoever sent that. And you're right, Tayon. It's actually identified that even amongst the Black community as a whole, our health-seeking behavior is somehow low. Uh, and even when it is necessary, yeah, good. We want let your food be your medicine, make everything natural. But seeking health advice is a form of a strength on its own, especially when it is available. Okay. Although we say, yes, don't panic about everything, or when a particular symptom occurs, maybe cough or cold one day and start calling the GP. Yes, we do encourage giving things the time to naturally pass through. But when a symptom is becoming long, now that long could be relative. Okay, it might be difficult to say, what do you mean by how long? But usually when things are going beyond a couple of weeks, it might be time to start seeking medical attention. Even if it's still something simple that should resolve on its own, there's no harm in seeking medical attention. And when you speak with the GP, he can advise on the expected time duration. If it's something that should resolve within 3 weeks, that they can say, okay, give it one more week. If it's not better, we need to do this. Okay, so that's talking about giving the natural cause his time. Okay, but let's ensure we don't trivialize symptoms when they're going beyond a couple of weeks. And if there is a significant family history, even in the absence of symptom, there's no harm in seeking medical attention. At the most, you'll be signposted to keep an eye on things because two things, it helps with you knowing what to look out for and what not to panic about. And it also helps the clinician on when to start escalating things. Okay. So I would say, please be encouraged to always call for medical attention when needed. And bearing in mind how I identified myself in the beginning also, a father, a son, your life is not just dependent on you. Many others are dependent on you, and you're a key figure everywhere you go.
Thank you. Someone in the chat also put that men tend to listen to the family in their, like the woman in their lives, like the mothers, wives, daughters, more than a GP. But like Dr. Omotola said that, it's your health, it's your life, it's just more than you that do seek help, attention from GPs for screening and stuff like that. Quick question from Chinwe. In your experience, doctor, what would you say is a common deterrent for people attending screening appointments, and how do we help increase in uptake?
Okay, statistically, I can't say specifically which one is the commonest ones, but part of the things we identify is education. For example, I've had what is supposed to be a 6 to 8 week baby check for a child that was over 1 year, which should not have been. So ideally, the neonatal screening should be done within 3 days. The neonatal screening means the first baby check, which is done within 3 days. On this occasion, what happened was that was done in the hospital, but they now moved from one region to another. There was no communication with the midwife, so settling in another place before the baby was 8 weeks, they got there, they registered with the GP, but for some reason it was missed. They didn't have what is called the red book, and the mom did not know about having a baby check. So it was when they registered, and I think the registration also took some time. Okay, so it was when they registered at the GP that I was that this triggered in the system, and we had to invite them. So came in, good enough, everything was fine compared to the 3 day baby check. So education is one. Then I'll say the fear of the unknown is also one. So like was mentioned in the rider of the flyer for this program, maybe not. So it's going to be a matter of maybe if they check it and there is something like cancer, I don't want to hear the news. Okay, so that comes into play in many people. Then, like I mentioned earlier, also being a person of faith does not negate your responsibility when it comes to taking care of your health. Some people, especially amongst the Afro-Caribbean community, they base it on faith and say, well, nothing is going to happen. Good enough. But you also have that responsibility to check and be sure nothing is happening. So those are like the common things that I found to have been the case. So a lady being invited for cervical screening, and they think, oh, what if they do it and it shows that there is high HPV and at risk of cervical cancer, then I won't be able to do this, do that. And the fear of knowing that is a sort of a deterrent. Now, if we do it on the flip side, what you're avoiding becomes an issue if it's not taken care of later. Because if it's now detected that the person now does have a high risk and ends up developing cervical cancer, all those things that we did not want will start happening. We know of one of our celebrities in the UK in 2009 then that had the cervical cancer. She had a normal screening at a very young age. She died, had the normal screening. Um, and because of the fear of going for follow-up with regards to the outcome of the screening, this affected her until the condition actually became cervical cancer, which was then now becoming irredeemable. Okay, so if we think about the other side of well, what if you go for the screening and you're able to pick it up earlier? How will you compare that to if you don't go and in the future it becomes a real problem and you're now forced, or let me say compelled to have to go? If we weigh both sides, it would be an encouragement to catch it early.
Yes, thank you so much. Just the last question, before we wrap up. So it's most Black men would never volunteer to go to their GP for prostate checks, probably because of how invasive the exam is. Could raising awareness in faith groups like churches, mosques, community groups help at all? Or do you have any other ways or stuff that you've done to help them get in for prostate checking?
Brilliant comment and question. Thank you very much for that. Yes, so using every platform available, which CAHN is efficiently leading in that. Okay, so I'll say thank you again, Tayo, and everyone in the team. These are kinds of platforms. So where do we meet people? Where do we come in contact with people? Like you've mentioned, places of faith. So churches, mosque, where the sick meet, any community, and even just a community meeting in a shopping mall or things like that. We do see some voluntary organizations doing that. So yes, you're right. Those would be like platforms. And if you're in a position of influence in such organizations, that can be communicated to the people or the leadership that can actually influence it. Okay. So because that will help to encourage people and that can be, communicated to them to say, well, yes, although we're people of faith, now, a faith that is putting all the responsibility on God is a sort of irresponsible faith. Okay, you have to be exercising your own responsibility also because you are here to take care of the body. So be encouraged, and I think having that good communication coming from people of influence also will help. So yes, I will agree and encourage that also.
Thank you so much, Dr. Omotola, for this session. Hope each and every one of you learned something. Thank you to each and every one of you for giving up an hour of your Saturday. And thank you for all the questions that were put on the chat as well. I'll hand over to Ruth just to close the session, and I'm wishing you all a lovely rest of the weekend. Thank you very much.
Thank you so much, Taya. Thank you so much, Dr. Omotola, for a brilliantly informative session. And it's great to have you both for the first time as well on Health Hour. It was a brilliant session. Okay, so hopefully technology will be on my side. I'm going to try and share my screen now. Nope, it's not doing anything. Okay, there we go. Okay, I'm pleased to say that we will have another health hour again next week. So if you can please join us from 11 a.m., we would love to have you. And we will have another doctor talking about an issue that's prevalent to the Black health to the health community of African and Caribbean people. We will be sending out more information in the next few days about what this session will be. So the 8th of March is International Women's Day, and we will be holding an event on Friday, the 7th of March, in celebration of that day. This year, our theme is womb health in the digital era. So we'll be looking into things such as fertility monitoring. We'll be looking at period trackers. We'll be looking at how digital innovations can help us take better care of our womb. And we'll be looking at fibroids and other health issues that are prevalent within the Black community. So please do find out more about this by emailing events@cahn.org.uk. You can also get in touch with our team via social media if you have any questions. So we have our Black Healthcare Awards on the date doesn't appear to be there. But it's on the 12th of July, Saturday, the 12th of July, and we have nominations open now. So you're very welcome to head to our website and nominate your health hero. The website link is blackhealthcareawards.cahn.org.uk, and you can also email us at blackhealthcareawards@cahn.org.uk if you have any questions, if you're struggling to complete the form, etc. You can also scan the QR code on your screen. On Sunday, the 9th of March, the same weekend as the International Women's Day event, we'll be holding an event, a commemorative service in remembrance of those that we lost to COVID in not just 2020, but in the years following. So please do join us for that if you are around in Greater Manchester. This will be from 7 p.m. to 9 p.m. at the Cathedral. We always have a lot of research opportunities at CAHN, and one current one is looking into MPOX. And this is going to give you a £25 voucher if you're able to participate for the online sessions, which will be just an hour long. So if you're interested in being involved, you can email research@cahn.org.uk, or you can head to the link there. You can maybe take a picture of it on your screen. And if you have any questions, our team will be happy to help you. Next Wednesday is the 5th of February, and on that evening, we will be holding a family and advocacy empowerment session focused on special educational needs and disability support and advocacy for Black children in schools. So if that relates to you, if you perhaps have a child that has special educational needs and disabilities, or you know somebody that's struggling with taking care of a child that deals with that, then please do invite them to the session or come along yourself. If you have any questions, again, you can get in touch with our team by emailing advocacy@cahn.org.uk. We have our Black Health Inequality Summit on the 26th of March. So that's a Wednesday, and it's an all-day event. Our registrations are now open. We had this event last year for the first time, and it went extremely well. We had, I believe, over 300 people participating. So if you are interested, now is the time to express your interest, because we want to be able to secure your place. It's a free event as well. If you have any colleagues that you think would be interested in attending, please do send the information on to them as well. Thank you so much for joining us today. We hope you learned a lot and enjoyed the session. I will pass over to our tech team now to end the session for us, and I hope you have a brilliant rest of your weekend. Take care.
Welcome to our Caribbean and African Targeted Health Improvement Program, CAHN Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@cahn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CAHN is funded by the National Lottery Community Fund.